So in one of my recent videos, I talked about not being afraid of facial implants. Well, some patients are, no matter how much I try to assure them that they are safe operations. For those patients, we talk about adding volume to the face in the form of facial fat transfer. Now, what is facial fat transfer? Well, it's a procedure in which I make small punctures in areas around the umbilicus or the belly button or on the lower love handle areas and infuse a saltwater solution. After a few minutes, I go ahead and perform microliposuction to pull out small fat cells. Then I basically inject those fat cells in various areas of the face. I can do a non-surgical radix augmentation. I can inject the temporal hollows. I can get the tear troughs, the mid-face, the nasolabial folds, the corners of the mouth, the lips, the jawline, chin, anywhere where I'm hollow and needing some projection. Those fat cells will then grab onto a blood supply over the first 72 hours to 6 weeks. And, survivability of the fat cells can be anywhere between 70 to 90% depending on various technologies and studies. But in general, a good percentage of these cells will then become new vascularized fat in your face. And when you're doing a facelift, you don't want to look flat afterwards. So doing a facelift, adding a little bit of fat in gives you a much more natural, youthful set of three-dimensional contours, reflection points. And when you're injecting the fat, you're also happening to inject what they call adipocyte or fat cell derived stem cells. And you start getting biological skin improvement from those stem cells. Ask any surgeon who does this, ask any patient who's had it done. They'll tell you their skin looks better. So some patients are like, I don't want implants. Facial fat transfer is a great option. However, if you're hypermetabolic, you love to run, you love to go to the gym, when I put fat cells in you, it's not going to do as well. And maybe some of these new cadaveric derived fat products like Renuva or Aloe Clay, they may hold the key to allowing fat transfer for the hypermetabolic, super sort of exercise heavy types of patients. So if you're really skinny, fat transfer may not work for you because what am I going to get from you? Like, where's the fat to actually transfer to your face? So for you, you might need some of these other new products that are coming on the market and being tested. So fat transfer is great. You get a lot of benefits from it, but it's not for everybody.